Welcome to This Explainer. Today, we're getting into something that is literally a matter of life and death: essential first aid and emergency response. You know that feeling of sheer, paralyzing panic when something suddenly goes wrong? Well, we're going to transform that into calm, calculated preparedness. We're going to give you the tools to actually be the defining difference in someone's survival. So, let's get right into it.
Okay, let's dive in. We're going to walk through 5 clear categories today. We've got first aid basics, CPR and basic life support, bleeding, burns, and injuries, severe medical emergencies, and finally, environmental and animal hazards. It's a highly structured toolkit, and trust me, it's easy to remember.
All right, Section 1, First Aid Basics, because immediate action is absolutely crucial.
Now, before we get into the physical techniques, let's talk philosophy for a second. First aid is all about what happens in those critical minutes before the ambulance arrives. And your primary goal really comes down to the 3 Ps. First, preserve life. That is priority number 1, obviously. Next is prevent deterioration, which just means stopping things from getting worse. And finally, promote recovery, taking steps to help them bounce back. If you're ever in doubt, just let those 3 Ps guide you. So, what do you do if you find someone unconscious? Well, step 1 is always to check responsiveness. Just gently shake them, shout a bit, see if they react. If there's no response, you move immediately to step 2, the CAB sequence. Now, you might remember the old ABC method, but modern guidelines have actually flipped this to CAB. That stands for compressions, airway, and breathing. You get the blood pumping first, then check the airway, then check their breathing.
Moving into Section 2, CPR and basic life support. These are the high-stakes, life-saving techniques.
When someone's heart stops, you've got 0 time to hesitate. You need quick, rhythmic, decisive action. 30 to 2. Honestly, if you only remember one number today, make it this one. For adult CPR, it's a strict ratio. You do 30 chest compressions, pushing down hard about 2 inches deep, followed immediately by 2 rescue breaths. 30 compressions, 2 breaths, over and over. And how fast should you be doing those compressions? The sweet spot is 100 to 120 compressions per minute. This isn't a slow, casual pace. It's a vigorous, highly active speed that's mathematically proven to be the optimal rate to actually force blood out of the heart and keep the brain alive. Think of the driving beat of a really fast-paced song.
But what if the victim is a baby? Now, for an adult, you're using the full force of your hands to get those 2 inches deep, but infants, they have incredibly delicate little bodies. So for them, you're only pressing 1.5 inches deep, and you strictly use just 2 fingers in the center of their chest. But the amazing thing is, the ratio stays exactly the same, 30 to 2, whether it's full hands for an adult or 2 fingers for a baby. Okay, another massive airway emergency: choking. The solution here is the Heimlich maneuver. You stand behind the person, place your hands just above their navel, and give sharp inward and upward thrusts. You're basically using the air trapped in their own lungs to forcefully pop the blockage out, kind of like popping a cork. Just a quick rule: never use this on a baby under 1 year old. They need a specific sequence of gentle back blows instead.
All right, Section 3, bleeding, burns, and injuries. How to handle external trauma.
So the crucial point here is we need to bust some major household myths. If someone gets a bad burn, do not apply ice, butter, toothpaste, or oil. No way. Ice actually restricts blood flow and causes way more tissue damage, and oils just trap the heat right against the skin. The only correct response? Run that burn under cool, running water for 10 to 20 solid minutes, period. Here's another incredibly dangerous misconception. We've all seen people tilt their heads way back when they get a nosebleed, right? Actually, scratch that. Don't ever do it. Leaning backward just makes the blood drain down the back of your throat. It can go into your stomach and make you sick, or literally block your airway. The correct move is to lean forward and firmly pinch the soft part of your nose for 10 minutes. For everyday muscle strains and sprains, just anchor this acronym in your head: RICE. Rest the injured area, apply ice to bring down the swelling, use compression like a wrap for support, and elevate the injury above the heart to stop blood from pooling. It is a simple, perfect little checklist to get you through structural injuries. Okay, let's slow down a bit for Section 4, severe medical emergencies. These are the internal crises.
Unlike a cut or a burn, emergencies like strokes or heart attacks are hiding on the inside. Recognizing them fast is literally half the battle. For a stroke, you use the FAST test. F is for face, is one side drooping? A is for arms, can they keep both arms raised or does one drift? S is for speech, is it slurred or weird? And T means time. It is time to call an ambulance immediately, because brain cells are dying by the second.
Let's compare two other massive internal emergencies side by side, a heart attack versus shock. A heart attack usually feels like severe chest pressure that shoots up to the jaw or down the left arm. You want to sit this person up, keep them loose and comfortable. Shock is completely different. It's a drastic drop in blood pressure, they'll be cold, clammy, and they might faint. For shock, you do the opposite. Lay them flat on their back and elevate their legs about 12 inches to force blood flow back into their brain.
Now, let's talk about anaphylaxis. This is an extreme, life-threatening allergic reaction, like from a bee sting or peanuts. The airway just rapidly shrinks and closes up. The ultimate absolute lifesaver here is an EpiPen. It has to be injected immediately into the outer thigh. It is the only thing that is going to stop that airway from shutting down.
Moving to our final category, Section 5, Environmental and Animal Hazards, dealing with unpredictable dangers. When you're dealing with the environment or electricity, you need clear, direct rules. If you see someone get a severe electric shock, listen closely. Never, ever touch them with your bare hands. You will instantly become casualty number 2. Step 1 is always to turn off the main power switch. If you can't do that, step 2 is to separate them from the current using something that won't conduct electricity, like a dry wooden broom handle or plastic. And speaking of making things worse, let's kill a massive Hollywood myth right now. If someone gets a snake bite, do not cut the wound and absolutely do not try to suck the venom out with your mouth. It does not work and you'll just infect the wound. Don't use ice or super tight bandages either. Your entire focus should just be keeping the limb totally still, keeping it at heart level, and rushing to the nearest hospital. Finally, let's look at extreme temperatures. For a heat stroke, their skin is hot and dry. Move them to a cool environment, use cold compresses. But remember this absolute rule: never give them water if they are unconscious. On the flip side, for hypothermia, get them to a warm room with dry blankets. But here's the catch: no sudden, direct heat. Don't stick them right next to a blazing fire. Heating a freezing body up too fast can severely scramble their heart rhythm. Let's move to this recap and see how everything builds your overall toolkit. On the left, we've got your physical essentials for a first aid box: gauze, ORS, antiseptic, the whole shebang. But on the right, that's your mental toolkit: the 3 Ps, the 30-to-2 CPR ratio, the FAST test for strokes. You really need both columns locked in to be completely prepared. Which brings us to the big question. If an emergency happens in the exact next minute, are you ready? Well, by going through this explainer together today, you now have the framework to confidently say yes. You've got the tools to push past the panic and actually be the first responder your community needs. Stay safe out there, stay prepared, and thank you so much for joining us.